I think we'll get started. Thanks everybody for coming. We're really excited about our discussion today, which is how to grow your CX culture. And we're also thrilled with the thought leaders and experts that we've assembled today. And before we even get going, I just want to thank those folks on the panel. We really appreciate the time that you've put into this webinar. We're very appreciative. My name is Jim Porter, and I am I head up the health plan practice area at Merge. And I know a lot of the folks on the webinar know who Merge is, but some will have maybe less familiarity. And just so you know, we're in 8 cities throughout the country. We work with about 15 different health plans, both blue and non-blue. And we work with about 20 different health systems throughout the country. And we like to say at Merge, we merge storytelling and technology to promote health, wealth, and happiness in the world. It's our reason for being in the niche that we've staked out in the marketplace. And just to give you an idea of some of the things we do traditional brand building, we do lead generation for Medicare, Medicaid, D-SNP, individual marketing. We do media and analytics. We do marketing automation, consulting, and implementation. We do engineering, platforms, and web development. And last but not least, what we're going to talk about today, we do a lot of work in customer experience. So if you have any needs in any of these areas, we'd be glad to talk to you at another time. But before we start, I'll say a couple other things on storytelling. I think there's been some feelings that with the advent of technology, that storytelling is not as important, and we tend to disagree. We think there's a symbiotic relationship between the two. We think that really good storytelling helps drive the use of technology. We like to think that storytelling engages hearts and technology connects the parts, and we think it's a big way, an important way to help differentiate your brand. So with that, I'm going to turn this over to Becky Minervino, who's going to be the moderator for today's discussion. Becky is the Chief Strategy Officer at Merge. And with that, here you go, Becky.
Great. Thanks very much, Jim. So excited to welcome our panelists. We are pleased both because of the depth of your experience and also really excited because CX is a small world and excited to hear you interact with one another too, just given your shared experiences. So welcoming Kent Lawson, who's Executive Director Customer Experience at the BCBS Association. Kent is an IDEO alum from the Global Health and Wellness practice, and he's been a guest lecturer at Cornell and Dartmouth, as well as the head of innovation at AbbVie, part of Abbott, where he traveled the world advocating for customer centricity within healthcare. Brooke Osenkopf, welcoming you as VP of Demand Gen at Virgin Pulse. And in prior lives, Brooke has a really interesting background in both CX and marketing. She was the director of e-commerce at Hilton, as well as the director of CX and innovation at BCBS Nebraska. Garrett Smith, CX Strategy Director from Merge, also former Director of CX at the Blue Cross Blue Shield Association, where he traveled across the country, helping folks collaboratively design solutions and forward more CX thinking across the system. And also, last but not least, very excited to welcome Gracia Carver, VP Chief Experience Officer at Blue Cross Blue Shield of Kansas City. Lots of accolades we could cite. Some of the things I'm most impressed by are the fact that under Gracia's leadership, Blue Cross Blue Shield Kansas City was named not only Best Measurement in CX Experience, but also Best Customer Experience Strategy and Best Customer Experience Culture, Customer-Centric Culture by the North American Customer Centricity Awards in 2020. So thank you for joining us. We're going to have a somewhat structured conversation for about 45 minutes. We're going to hold 10 minutes at the back for concerted Q&A, but we welcome chats along the way, and I'll do my best to weave in those questions. So if you've got a comment, we encourage you to toss it in there. And if you've got a question, likewise, and we'll either try to take it if it's topical or hold it for that last period towards the back. And to get us warmed up, I'd love to invite each panelist to say a few words. You know, one of the joys of working in customer experience is all the myriad paths that people take to it. And it certainly shapes folks' outlook. So would love for you each to say a few words about how you got your path to CX. And perhaps, Kent, would you like to start there?
Sure, Becky, thanks so much. It's great to be here. Yeah, nobody goes to college for CX, at least they didn't until this year at Michigan State. So my path has been through industrial design. I have an industrial design background. Went to lead the health and wellness practice at IDEO, and where, you know, I got really schooled in human-centered design. And that to me is what CX is human-centered design, because we're trying to design experiences and design, I guess experiences for humans, for and between humans. So that's how I got into this.
Awesome, thank you very much. Brooke, would you like to share a bit about your background?
Absolutely. So my path came from no formal training, but more from curiosity. So at Hilton, we were really getting into this space of digital, and that was super exciting. My path at Blue Cross Blue Shield of Nebraska started off with implementing digital tools and looking at measurements. And as we started realizing we could really be smarter and more targeted and really kind of remove some of the uncertainty or barriers that existed, it was really curiosity that propelled me into the role. And then from that, all the great resources that the association provided, Forrester, et cetera, really kind of gave me that grounding behind it.
Awesome, thank you very much. Gracia, would you like to say a few words about your background too?
Sure, I'd be glad to, and thank you guys too for having me. This is, you know, obviously a passion of mine, and love talking about CX and how it can really change and innovate our companies. I really came to customer experience through customer care. You know, a lot of consumer products and services, everything from boxed chocolate to Mickey Mouse ears and some things in between. And I will tell you, my first inkling towards CX was many, many years ago, when I found myself continually challenged and frustrated with vendors and suppliers and providers, and even the company, you know, trying to fix the call center, right? And, you know, fixing the call center is an ongoing forever kind of thing. And the reality is, from an experience perspective, the call center doesn't drive calls into the call center with aggravated, upset, unhappy customers, right? Where does it come from? The rest of the organization. So starting to create a CX improvement path across the organization to enhance the experience, drive those pain points out, reduce, eliminate hassles, that becomes an experience function and activity versus a care. So I just got very, very lucky in falling into that, you know, in my care background, having Lean Six Sigma and some human-centered design, all those components, measurement, those were all very strong. And so I could take those and apply them to a CX improvement practice and really start driving change across the organization. And then to Brooke's point, I also teamed up with Forrester, and from there, it kind of blossomed into experience.
Awesome, that's so fascinating. Thank you very much. Garrett.
Yes, so I also started my career in industrial design. I designed a lot of products where I made cakes and decorated cupcakes, and that was a lot of fun, but I was really just trying to figure out the why behind the what, which brought me to learning all about human-centered design and this wonderful innovation program at SC Johnson for a number of years. And from that point, really realizing that solutions go beyond the product, and it's about the experience and how everything is intertwined is what really solves problems for customers. And got the opportunity to go to the Blue Cross Blue Shield Association, got the opportunity to learn from all these wonderful people on the webinar right now, which has really sort of shot me into the bigger world of CX and how to bring human-centered design into the structure of everything that creates an experience for customers and members throughout that end-to-end journey.
Awesome. Thank you so much. All right. Well, maybe on that topic, the first thing we'd love to hit is, I think that few self-respecting companies would argue against the importance of being customer-centric, at least in public settings. But what that means in terms of like, what does a CX culture mean, I think does vary like quite widely. So I would love to hear, from your vantage point and maybe at different points that you've worked, what does it mean to have a CX culture that's high performing? Brooke, would you like to jump in and start us off with this one?
Yes, but I feel like Gracia is the expert here, so I'm excited to hear her response. So from a CX culture perspective, in my path that I took for CX, it was really strategically focused on core areas of the business that we knew that we wanted to expand into. And so as part of that like CX culture, it was bringing together business objectives, thematic goals, aligning those with, what is the experience today? What are the stories that we're hearing from our employer groups or our customers, and how might we make the experience better for them? So I would say that from a CX culture perspective at Blue Cross Blue Shield Nebraska, it was really centered around business objectives and how we wanted to move those objectives forward. As I've branched out and looking at opportunities at Virgin Pulse, a lot of what we work with here is in terms of data and insights that are propelling not only what does the market want, or what are the business needs, but also like what's driving the technology, what's happening with our members, what are some things that are coming forward that we really have an opportunity to impact. And those things might not be things that are broken. They might just be surfacing up ideas that we say, oh, that's really interesting. We have a lot of people that are looking at a particular topic. Let's explore that further. Let's dig deeper. And so that has been a shift, and that's been a shift in my knowledge as well and skill set growing that. But it's been a really fascinating shift to be a part of. One of the ways that we explored this was through DEI and creating DEI as a first principle. This wasn't a market objective. This wasn't businesses coming to us and saying, we really need a DEI strategy. Rather, it was us realizing what the data and insights were surfacing and understanding that we really had something special that we could lean into and make even better if we spent time and effort as a collective group to do so.
Awesome. Super interesting. Gracia, would you like to build on that?
Sure. Yeah. And to Brooke's point, when I compare and contrast what we've been able to do here at Blue KC, and we have been really fortunate to build a strong culture. And I think about why could I do that here? And in my prior role, it was like pushing a boulder up a mountain. And really, when I compare and contrast that, what I see, and again, a lot of this is my own learning, right? Like this didn't work back here, and now I could do it differently over here. But comparing and contrasting, Blue KC, members first, customer centricity is on our corporate strategy page, front and center, right? CEO talks about it in every meeting. Every senior leader understands, and we've done some other things, which I'll get back to in a minute. Prior organization, the word customer wasn't even on the strategy map. Right. So we had to kind of start there, and then pushing anything without being tied to corporate strategy is just very difficult. And if you don't have that top-down approach, it's very difficult. And I know for us here, I had those foundational pieces, which allowed me to just build upon. But then next, you got to find ways to evolve. And I don't like to use the word change because there was already a lot of good work going on, but to evolve behaviors. Without behavior change toward customer centricity, there is no culture. It's behavior and rituals that create a culture, right? So we created ways to motivate behavior. We touch wallets with what we do. We also say everyone owns experience. It is not a department. And we have ownership in the organization to touch points. And they also have their own measurement. So we measure very intentionally, hold people accountable to it. But again, we build upon that foundation of, CEO, senior leader buy-in.
Wonderful. Thank you very much. Cantor Garrett, would you like to add in terms of you've had the benefit of working at the association, seeing a lot of different companies, also your background at IDEO, Kent, any other key themes or patterns to this idea of like what a CX culture is characterized as?
Yeah, I think I would build on Gracia's points that CX, a robust CX culture is a bottom-up endeavor, definitely. But you've got to have the C-suite bought in. You've got to have the C-suite telling stories. You've got to have them saying, I was with a customer, I was with a member just last week, and here's what I learned. And so often I think in our business, maybe throughout healthcare, the executives live in these ivory towers, and they have sort of their lives don't reflect the lives of many of the customers. And so we really need to get the executives into customers' homes, to really sort of feel, not just listen to, but feel the stories that are going on, so that they can reflect that back into the organization. And it doesn't matter where you're sitting. You could be sitting in finance, you could be sitting in product design, in customer service, anywhere, in claims adjudication. You need to know that your job is connected to real people, to real humans. And that's where we get the culture from both sides, from bottom up, understanding that my responsibility is to the member, but also top down with the stories of our impact and our purpose.
That's great. Thank you. I love that contrast between the top down and the bottom up. Let's talk a little bit more about some of the barriers that folks run into in terms of trying to achieve that, because it is so dependent on cross-functional buy-in. There are some other themes with regards to how do you create an environment of psychological safety, like a place where people maybe they're intrigued by it, maybe they know they want to start to affect change or operate differently, but it can be intimidating. Any stories folks would like to share about, how do you, if those are some of the tenets, like how do you get started with, in addition to getting your CEO on board? Gracia, any tips there maybe from?
Yeah. And I will tell you, I didn't think about it this way at first, but I think, to your point on safety, I think we ended up creating it a little bit by accident. But what we do here is we do a lot of co-creation, and we title the meetings, we are going to co-create XYZ experience, and we pull in all of the right key stakeholders. And it makes such a difference, because at the end of the day, we really need to rely on the subject matter experts anyway. And what we've learned here is that people are used to kind of doing their job, and they're not thinking about the upstream, downstream effects. So when we all get in a room and map the current process and co-create the new process, the eyes just open up. They feel a part of owning it, and they understand the A to Z of it all. And it's just made a huge difference for us, and people being much more open, realizing that everyone else has gaps in their own knowledge. It has really made it's been a game changer here for us.
That's wonderful. Yeah. I mean, I know, Brooke, I know you've got a lot of passion for the topic of psychological safety, like widely popularized, I think in my experience, like by the study that Google published maybe like 5 or 6 years ago now, of the #1 factor in high performing teams is psychological safety. And it certainly only gained, I think, in momentum and importance, especially, as we've shifted workloads. Would you like to talk a little bit about that and how it's practiced at Virtual Pulse and what you encourage there?
Yeah, absolutely. To add on to Gracia's piece, we are a learning community. So not only are we co-creating together, we are learning together, and that is the absolute first tenet of any sort of group activity that we're working on. I know certain parts, you might know certain parts, but together we are all learning. And the way that we, celebrate learnings, the way that we celebrate ideas, the way that we celebrate bringing those forward creates this level of psychological safety that I think, especially now during COVID, as people are remote, a lot of the folks that I work with today, I've never met in person. And so we have to have, that level of receptivity. We have to be able to have, conversations. We also need to understand that people are at different levels in their careers. They bring different perspectives, and everything is welcome because we are all learning together. I spend a lot of time with Dr. Batman, who's on our Virgin Pools Science Advisory Board. And one of the items that he brings forward in his work around health and safety, typically with manufacturing clients, is he'll go in and they'll have, place sticky notes about what safety means to you. And he says, okay, take all those Post-its down, because usually they're tripping on wires, wearing masks, not smoking, those types of things. And he says, what's behind all of that that we need to uncover and unpack? Everybody knows not to trip over a wire. And yes, unfortunately there's those things that happen, but what are the true root causes behind this? Do we feel safe to talk about mental health? And if I'm saying something about mental health, are you listening to me and not thinking about how am I going to achieve a metric? But instead, really taking that information and deciding what the best next step is for the individual. We had a client that was seeing mental health come up as an interest topic area. And one of the really interesting things that we found in working with them is that the C-suite was bought in. These were benefits that they were so super excited about, that they had been touting to everybody. But middle management didn't get that memo. They heard metrics. I need to, hit these metrics. And a lot of those folks had been promoted into their roles because they achieved perfection. So you can assume that, they haven't gone through that level of training. And so we were able to come in and say, here's a root cause analysis, and put one of our anxiety and depression coaches with the team to talk through, just skill set training. How do you ask somebody how they're doing today? When you ask somebody that question, what are you hearing back? How are you listening? How are you providing them with the next tools? You don't need to be a physician, but how do you know where to direct that person to go? So psychological safety has a variety of different levels. And I think as a CX professional, it's important that we understand we may not always be in the leadership role, but we can always be the catalyst to creating that psychological safety for the folks that we're interacting with, the clients that we're talking to, the members that we're pulling those stories from, because we're going to be the ones that can help drive the organization forward.
Love that. Everyone can be a catalyst. That's lovely. Thank you very much. Garrett, did you want to add to that?
Absolutely. Building off of what you're saying, Brooke, we spend so much time trying to inspire empathy for our members, for our customers, that I think sometimes we forget to show that same kind of empathy, that same kind of energy towards understanding people's positions with our own colleagues. So much progress could be made if we can use those same kind of skills that we have to really understand people's positions, because evolution of what an organization needs to do from a CX perspective, it's hard. It's everybody's just trying to get by. Everybody has their job. Everybody's trying to do a good job. And now you want to do something different that might take more time or require you to learn new skills. That's difficult. That's more work for people, and we're already busy. So we need to understand how we can help everybody evolve at the same time. And a lot of that starts with showing that same empathy for our colleagues as we do our customers.
Wonderful, awesome. Maybe like, well, one of the strategies that we thought we'd spend some time talking about is on the topic of empathy. Like famously, probably one of the most central tenets, right, to human-centered design is trying to understand the world from the eyes of the people we're designing for. You know, what their motivations and behaviors and underlying needs might be. You know, there's so many different strategies that one can use in order to both capture those stories and then share them. So I would love to shift to that topic, maybe starting with you, Kent, in terms of strategies for like what you've done to sort of elicit and capture stories and sort of have them take hold.
Yeah, thanks, Becky. A couple of things pop to mind. Number one, figure out ways to prototype the experience. And I'll give you one example. So we were working on designing durable medical equipment. This is walkers and maybe shower chairs, things like that you use in your home. And we asked the executive team, have you ever used these? And they all said no, if you can imagine. And so we challenged all of them in the meeting. We had a half-day meeting, and we gave them all a few bucks and a walker, and said, you have to go buy a gallon of milk, and this is your only transportation. And so they went and tried to find a gallon of milk in the city of Chicago, and had to lug that gallon back on their own. So try to figure out ways that you can prototype that experience. That's number one. Number two is actually, you know, if it's something technology related or something sort of claims related, actually take them through the process. Now that could be in the form of a like a journey map, but it could also be in a form of prototyping the experience, making them actually go through the UX UI so that they get a feel for what really happens when something happens to them from a healthcare perspective. It really ends up opening eyes to the whole world of the member.
Yeah, that's wonderful. What a great idea. Grisha, interested in your slant on this, particularly just knowing there's from a measurement standpoint, there's a lot of strategies that you've put in place. I'm curious about thinking about the hard numbers as well as stories and how you might work to capture stories as part of your overall like voice of the customer efforts.
Yeah, we do a lot. We actually have leaned on Garrett and Kent in some cases too for help there, but you know, we do have a very strong measurement program here for sure, but we do when we're trying to solve a problem, we engage kind of on several fronts. One, just data driven, you know, what are the problems that our members are telling us about? Two is some Lean Six Sigma tools in terms of current state mapping, future state mapping, but in the heart of all that is our human-centered design. And I'll just give you, you know, one deep example and talk about a couple of other things that we've done too for the employee group. But one of my favorite examples is when we were trying to solve a problem, we did very, very deep dive interviews with some of our members, and not only did it show the impact of the issue for that member, which built a little bit of empathy, but it also showed the impact on her life. So this was a person with chronic condition. We couldn't get her member ID card correct for a lot of reasons. And she quit going to the doctor because her claims were getting denied. And you know, just, so it's not just the impact of the issue that we're trying to assess through this human-centered design, it's the impact to their everyday life. And potentially in this case, the impact to their health. You know, this is very concerning when you have a chronic condition. So again, bringing that to the front, and what we do with that, we actually played that call and played the interview, did the research where our CX council, who are key stakeholders from across every part of the company, and other key stakeholders involved in the process, the ownership of the process for member ID cards, we're all involved in our co-creation. So again, where co-creation comes to life. But when you have to hear it from a member, this is what happened to me and how it impacted my life, it changes the game. And it's just empathy times 10, right? They get it. A couple other things I'll talk about since we're on the topic of empathy. We do a couple of things with our employee base too. And I think Brooke mentioned, you know, the employee and maybe Garrett too, the employee experience is so critical in this. Because if we don't get that right, it's really going to be hard to get customer experiences right. Let's face it, it just is. So we do a bunch of things. I'll mention two. One is we do random acts of easy for our employee base. And so one example is we will rent golf carts. We have a huge parking lot, and in the winter, it's not much fun to go from there to the door, right? So we'll rent golf carts and we go pick up our team members at their car. And on the ride to the door, we'll talk about, we wanted to make your day easy for you today. Just like what, you know, we want to make things easy for our members. So we really try to help our employees feel what it's like to have something made easy for them.
Yeah.
And then the last thing we just did this year was we're always trying to create empathy and awareness and keep the culture alive from a customer-centric perspective. And this year we decided to highlight our very first member. 85 years ago, Betty Jackson, the first member we ever had at Blue KC, the importance that she played with the company she worked for and ended up playing in the community. And we have built a plaque that is in every one of our conference rooms. What would you do for Betty? Right. So we're trying to keep that forefront. She worked for a bakery. So because we're remote, we sent a box of baked goods from that bakery to every employee with a story about Betty.
Wow, that's so memorable and very personal. It's really beautiful. Awesome. Maybe building on that in the idea of like capturing those stories and sharing them, like the mementos, the baked goods, the plaque, things that people, I love the everyday acts of ease, random acts of easy. Maybe Garrett, I'd love for you to talk a little bit about like how other strategies that you've also taken in terms of like trying to capture those moments in a way that is authentic, but also like captured. So talk a little bit about your strategies for doing that.
You know, I was thinking about the different ways of doing this, and it brought me back to this one like big mistake that happened at the very beginning of a workshop. We had been doing field research, and somehow all of our videos got ruined. And there was a couple of days before we had this workshop at the CXLC. We had people flying in from all over the country, so like high stakes. We were really nervous. It was really pretty early in our CXLC development. So we had to figure out what are we going to do about this? You don't have those wonderful videos of people speaking and really emoting what they experienced. So what we did was we had these big whiteboard, like rolly whiteboards, created and drew out the story. We knew the research, we knew the journeys, and we had all these boards, and we were able to bring people together in front of these boards, talk to the story, do it at a large scale, and inspire discussion. And from there, being able to identify what are these problems throughout the story, and then use that as inspiration to then figure out what you need to do about it from there. And what made me think of this is just thinking about how a lot of times, you know, telling these stories, it can be very low fidelity, it can be very simple, but as long as you can get people to engage in some way, if you can get people to engage in a story and to spark discussion, then that is what's going to help make those change, those first few steps to doing something about it. And I think that's it. Where to even start with that, doing it at the simplest level, it's telling that simple story, not worrying about it being too fancy. But as long as you can get people engaged and talking, then you know you're making a difference.
That's beautiful. Yeah, the simplicity of it, of just having a conversation. Ken, did you want to add to that?
Yeah, I want to add to that because I think it goes back to what Brooke was saying about psychological safety and what Garrett was just mentioning about, the sort of the workshop blowing up and the ability to save it and the low resolution prototype. The organization has to be okay with failure. And that is going to set you up for the best culture in terms of CX. If you're okay with failure, you're okay with trying. And that's what I think so many organizations lack, is that they are so sort of top down or so tyrannical that failure is not an option. It's gonna get you nowhere with that attitude. We have to learn to fail early, fail often. That was the fail fast was the motto at IDEO, and I think it holds true to all CX cultures. That's how we get there.
That's wonderful. Thank you. Let's talk a little bit about what are some signs that, as you're making progress and maybe learning from what doesn't work and embracing the process and the change, like what are some signs that it's working? Like how do you know when it is taking hold, whether that, any signs or even through to like more formal KPIs, but like what gives you heart when you look around at your programs today or in prior engagements that like, wow, okay, we're really starting to get somewhere. Ken, did you want to take that one?
Well, I actually think Gracia and Brooke are the ones that can answer this best, but I'll take a shot that that you start seeing people acting differently. They're taking responsibility for the project itself. With with all the measurement that's going on, they are taking hold of the accountability for their segment of the business and actually having the ability to make change. And that's what we're seeing with these voice of customer platforms. They're creating an environment of democratized data, and then the accountability that follows with that. Once they've got that ability to act on the numbers, that's where you see a real shift toward human centricity. I don't know, Brooke, Gracia, back me up here.
I agree with you. I think kind of wrapping this question into the previous question around empathy, I did a stint at a fintech, and excuse me, one of the things that was super cool around that is, we were trying to innovate in this space, and our product team didn't have all the knowledge pieces. They were very much learning. We were all just kind of like learning as we go, but we had this idea. And one of the things that we did was we did an ethnography with our buyers. And after each session, we had the CEO record like his thoughts, like just give me your raw thoughts. And it was great because he would say things like, oh my gosh, I totally thought this, but that's not right. And so it was nice to like get stuff out of his head and like have human interaction, because then we were able to take that and have conversations, and the product team was there as well, but we were all kind of on the same like level playing field. We all hear different things, we all see different things, but it was nice to have somebody at the leadership level showing like vulnerability, or showing, hey, we probably need to take a different step, or we need to think about things a little bit differently. And we combine those ethnographies with the buyer, with the employees as well. So we were able to tie those things together. And then it was just like a quick, at the end of the day, just record yourself, like all your thoughts from the day, ship it over to me, and we'll combine that with the data that we have to say like, okay, where should we go next? And that was just a nice departure from heavy reports and does this report really say this, or does it really say that over there? It was just this level of vulnerability that was nice.
Yeah, that's lovely. I love the lightweight touch and the ability to level set with everyone about maybe you've got it right, maybe you've got it wrong, and here's what we should do instead. Wonderful. Gracia, is there anything you would like to add to that basic question of like what are the you started sharing some of this already, but like what are the signs when like things have started to turn, like when storytelling's really starting to take effect?
Yeah, I mean, the easy answer we see it in our scores. And we built a pretty robust program that I mentioned, but what's even better is when, you know, to Ken's point and to Brooke's point, when we think about being a learning culture, fail fast, when you start seeing people take action on their own without being asked to take action, which, you know, is so fulfilling to see. And when I walk into a meeting room or I join, you know, a Teams meeting late, and I'm already hearing people talk about, well, that's not going to work for the member, and we really need to think about how this is going to behave for the member. That's when you know you've changed culture, right? Their conversations change, the mindset changes, and you see it in the actions that they are taking. You know, one of the things too, I think is really important in all of this is finding ways to build recognition around those behaviors you want to see, and being very intentional about that. So those rewarded behaviors will be repeated behaviors.
Yeah, that's really interesting. What are the importance of incentives is always a fascinating topic for me, because it can be easy to get them wrong. Like incentives are incredibly powerful, and if you have unintended consequences sometimes. So what's an example of building recognition that's been effective in your experience?
Yeah, really two things. So we do incent on customer centricity here, but it's incented at the relationship level where it really cannot be gamed, right? So that's one of the problems. You have to be really careful about incentives and how they're done. And so that's kind of a foundational piece for us now. It's changed behavior and people get it. But I think, you know, for us from a recognition perspective, we have a program in place that's actually run by HR. And this was another thing that proved to me we're building the culture. HR came to us when they were building the program to say, we want to make sure we factor in a customer-centric category in this recognition program. And so now we see all the time people getting recognized, not for money, but for behaviors that they've done to say, you just made that easier for the customer. And here's how you did it, and thank you. And sometimes it's a simple thank you and recognition on an email, right? But we have to be talking the language, looking for those behaviors, observing them, recognizing people when they take action and ownership, and talk about it.
That's wonderful. I love the simplicity of that too. But and you're right, like the being able to say, this is why it was better for a member, and this is how you contributed. The implicit reward of knowing that it was your work and your outcome that led your behavior that led to that outcome. Awesome. Garrett.
A simple sign that you're making progress is that you start to get really busy and you get invited to a bunch of meetings and people start asking you for your personas and your journey maps, which is kind of scary because it's like you hand it over and you don't exactly know what's going to be done with it. But that's a great sign when so many times, and I've seen you be invited to do this so many times. You and Felicia, the managing director of CX at the association, come to the beginning of this workshop, come to the beginning of this meeting, and talk about these customers and being able to talk through that to inspire the beginnings of whatever subject one of those workshops might be at. That makes a difference because time is valuable. Giving you time, giving you a space, and giving you a place to do that shows that there's a lot of value and there's progress being made with CX in the organization.
Yeah. So yeah, with welcome room, we're rounding out towards the back part here. So would love to get chat going. Encourage anyone in the audience to post a question, or including if you've got comments or questions related to incentivizing behaviors or another topic you'd like the panelists to jump into. The chat is open. We had a little bit of technical difficulty at the beginning, but it is now available. Maybe,
Hey, Becky.
Yeah, go ahead, Kent.
I'd like to ask Brooke to talk a little bit about, you've got a mobile platform. I'd love to hear about your thoughts on CX from a mobile technology platform, and what are the things you're wrestling with, and what are the I guess the things you're really excited about?
Yeah, that's a great question. So the item that comes first to mind for me right now, because I've been working on this project, is around using like mobile or digital technology to reach the hard to reach. So the folks you don't have email addresses for, you don't have phone numbers for, like, how do you get them engaged in digital activity? And we've had a lot of really great conversations with clients that have seen success in this. And, it's funny when you take a step back and you think about, maybe I'll do this, maybe I'll do that. And you come up with these really grand plans. I don't know if anybody else is like a grand plan person, but I'm totally a grand plan person. And one of the clients I was talking to stated it so simply. She just said, you just give them a voucher that they use to redeem for an incentive on your digital platform, and they're in. You don't have to worry about it. It's literally, they just need like that one small act to take the next step. And when you start thinking about CX in that perspective, journey maps are fantastic. You have all these different touch points you want to do. Oftentimes it's just that small step that needs to happen that you need to place focus on to make the next domino fall, to make the next piece fall. So, I mean, that's kind of the exciting things is interacting with our clients and members to identify those like small acts that we ourselves can't see because we might be blinded to that, but they have, a simple solution if we really ask them the questions and listen to that.
Yeah, that's wonderful.
Hey, Becky.
Yeah.
I have a question from the group, and I think Brooke touched on it a little bit, but the question is, how has your CX culture been affected by remote and hybrid work? And are there things you have to do differently to keep remote employees focused on CX? Who wants to take that? Gracia?
Yeah, I'm happy to. So, for us, it was kind of an interesting situation because for our customer service organization, they were already 100% remote. So we were already playing in both, sandboxes, if you will. We did have to get really, really good, though, at making sure every employee got the things that we were sending out, right? And again, our incentive very intentionally designed, right, at the relationship level, that again tells everybody owns experience, was already in place, and it doesn't matter where you work to get that, right? And then the recognition and reward program that we have is digital. So everybody was already really used to that. So I think for us, because we played in both sandboxes already, it was a little bit easier and less adjustment. And we had things in place that really fit well for the remote situation.
Yeah, I mean, one of the things that's interesting to me is just if you think of over the last 3 years, how many people might have started a job that they've never met in person. And so some of the practices and principles, I think someone made the point earlier that like, you can't change culture, you change behavior, and culture is a reflection of that behavior. So I don't, when it comes to new employee onboarding or any strategies, just knowing that folks are, maybe starting a job in a very different way. When it comes to employee experience, I wonder if there are any observations, tricks and strategies to try to express what the value of CX is to the organization for those new employees.
I think one of the pieces from an onboarding perspective is to create that sense of belonging, to connect them with folks immediately and start that conversation. So I think oftentimes we wait until we have something perfect, or, I'll put together this toolkit and they can view this toolkit. But really it's creating those connections, having the face-to-face time, even giving them like, here's things that you can talk about, or, here's things that this person's really fantastic at that you can learn from, really helps kind of accelerate that CX learning curve too often we rely on somebody to look at papers or watch a video or, do whatever. And it really comes down to like that human connection, because that's ultimately what we want them to do at the end of the day, is to take those stories, create empathy from that, and make change happen.
That's awesome. All goes back to behavior and practicing and not letting perfect get in the way of good. We have a question from the audience. Carrie Campbell, there you go.
Hi, can you hear me?
Yes. Perfect.
Yay, it works. Okay. My question has to do with what level do you expose individuals to when it comes to the process that we all go through as CX practitioners? I think a lot of times we're so in the process and we're like, this is really important for people to know the number of people we talked to and the research that we did. And I'm just curious, like, what's the right level of exposure, and or what's the right way to communicate the process to people where it actually makes sense and resonates with them? So who's had success in that area?
Jared, did you want to?
I'll take my shot at it. I don't know if this is that satisfying a question, but like, there is no right way. There are best practices as far as simply communicating the process, not overwhelming people, relying on visuals. But I think it really comes down to similarly to what I was talking about with understanding who your audience is, what it is that's important to them, and you might have to be reframing your process in ways that matter to those people that you're working with. And that's a lot of work. And that sometimes that might be most of the work that you're doing. But that's sometimes what it takes to be able to move these kind of initiatives through an organization. So essentially, it's understanding your audience, your colleagues, knowing what moves them, and then being able to communicate to them in the right way. And the right way is going to change almost every time.
And one thing I would add to that is I think it's really, really important to get the core team of your client side. So that could be colleagues on another side of the business. It could be somebody from the outside, whatever the case. But you have to get the core team full exposure to the process, to the sausage making, because without that, what change and innovation and true CX is, it's evidence-based design. And so your core client team has to see the evidence. They have to feel the stories. They have to live the stories. That all the empathy that we've been talking about, they have to live that. Because if they don't live that, the evidence isn't real to them. And so it's just another slide in a PowerPoint deck. You have to get your client team to live the problem. That's when the change happens. That's when the everything shifts.
And I'll pile on that, Kent, and I'll give a very, very recent example of that very thing. We have a portal that is just not what we need it to be for one of our call centers, and long story. And our partners in IT were doing a fantastic job of getting money to start attacking that thing, and they built a roadmap, and I saw it and I was like, So we actually got them on the phone and we had them attend our deep interviews with people who were actually calling because they couldn't get what they needed out of the portal. And then we had them listen to a half a dozen phone calls from these people, and they heard how frustrated they were. They heard what the issues were, and that team, their eyeballs in the meeting were like, and they went back and completely redid the roadmap to fix that portal.
Wow, that's beautiful. It's so powerful. It's funny sometimes just how fundamental it is, but it can be so arresting just when you hear in words that you cannot misinterpret the way you might like a data point on a graph, that
Right.
The degree of frustration and how much impact it has on people.
Right. Or even me saying, hey, they're really frustrated. When someone has to hear it themselves, it just changes the game.
Yep. That's
One
great.
of the items I want to bring forward is at Blue Cross Blue Shield Nebraska, I would take journey maps and they were, kind of half done. We were in the research phase. I would blow them up and put them outside of my office door and say, like, these are the points that I'm investigating. And I sat on the same floor as customer or member service. And I would see people come over on their break and look at the journey map and say, oh, you know what? I think I can impact that. And then sit down and have a conversation with me. And so it's not always like your core team and, getting all the stakeholders in place. Sometimes it's just somebody to walk by and say, I see you have a problem and I have an idea to fix it. And they oftentimes from member service would have all the data points that I needed, right? And it wasn't something that I would know anything about. And so sometimes it's just, even if your work is not completely done, just exposing something and saying, hey, I need help here is sometimes the easiest way to get you to the next point that you want to go to.
That's wonderful. I love the theme of like peer-to-peer, interpersonal, like telling the stories that are on an individual basis, helping people understand at a ground level how something is impacting the member, but also like the way colleagues within the organization can collaborate and support one another. I think we're rounding things out. We've just got a couple minutes. I thought I would share a couple of key themes that I've heard so far. Thank you so much. I think it's been a really rich conversation. Was really excited about the initial comments related to like the complexity of a CX program is most effective, of course, when it has top-down buy-in, but it also needs to have bottom-up participation. That contrast, that it's a bottom-up endeavor to pay it off. But if management from the most senior levels isn't yet endorsing it, it could be really a struggle. But that you need both of those things, and that seeing your job is connected to real people and real humans is one of the most central outcomes, and that there are lots of different ways that we can work to do that. Psychological safety is something we talk quite a bit about. I love the theme that like you may not be in a leadership role, but you can always be a catalyst for psychological safety, and like the curiosity, I think, that Brooke described as being a driving factor for her career, how that applies just to successful CX programs of people that are curious, want to understand like what was the root issue, and then what could we do to start to tackle that. We talked a little bit about the empathy that we need to have for our colleagues, in addition to designing for our end users, and that it can be challenging to try and fail new things, and part of the magic is encouraging and being empathetic and graceful with each other about as we make those efforts and learn what works, and not being afraid to acknowledge like that didn't work, and now that's one less thing that we know doesn't work, and now we can be on to the next thing. And then just generally the theme of conveying the stories and modeling the behavior. So not letting perfect get in the way of good. So thank you very much. This has been everything I was hoping it would be in terms of a great way to spend an hour. From the Merge side, we have a lot of heart for all of these stories and activities, and humbly submit that we're interested in your CX problem. So feel free to reach out to us. We'd be happy to chat with you. And once again, like a very warm round of appreciation for our panelists, Kent and Gracia, Brooke, Garrett. Thank you so much for spending your afternoon together with us. It's been fantastic, and look forward to next time. Thank you very much.
Thanks again.
Thank you.
Thank you, everybody.
Okay.
Bye.
Bye-bye.
Bye.
Bye.